Hi, my name is Wesley, and I'm going to run through a brief overview of the charting an office visit using Mountain Meadow EMR. First, the clinical assistant will come and welcome the patient, Beetle Bailey. Now, as you review the screen, you'll see a list of menu items across the top that are occasionally used, and a bar of menu items on the right side, which are commonly used, starting with the memos to myself, look up a patient, patient information, vitals, problem list, medicines, notes, past history, labs, preventive items, immunizations, images, heart risk calculator, notes to sign, tests to sign, documents that have been scanned in, and the bottom item on the bar is a back, which just returns you to the previous page. So now back into the chart notes, the assistant will start a new notes for an office visit and ask about the chief complaint, which for Beetle Bailey is that she's here for a routine visit, recheck, blood pressure, and also complains of esophageal reflux. Okay, well, the assistant will review the medicines and see if they're up to date, and then add the vital signs, add 175, blood pressure, sitting, regular. Then she'll review the preventive items. And lo and behold, there's a flu shot that's due. So we'll ask, "Can I give the flu shot today, or do you decline?" They say yes, they'll do it. So the nurse will go ahead and give the shot and document that influenza shot today from Patsy, and the info sheet and lot number or what they were last time that flu shot was given. So now the patient is ready for me to see. They will log out and I will come in and log in. Now, when I edit this note, I'll show you that the choices on the left include subjective, objective, assessment, and plan. And under subjective, I'll add some history and history of present illness, such as the reflux has been 2 weeks, not having any trouble swallowing. Let me address some of the other problems on the problem list, which is important because this keeps me from forgetting something that might be important. They are taking their B12 pills. Let me ask if they know that they don't have pernicious anemia, which might need shots instead of pills, and they don't know whether I've ever checked that or not. So I'll scroll through or search through the text of the note to see if I've ever said antiparietal. And sure enough, I did an antiparietal cell antibody test back in April of 2015. So if I can find that, 2015, it was negative. Let me go ahead and put that in the problem list as edit the problem so I don't have to ask next time. Negative antiparietal. So that'll remind me next time. Heart failure, they're doing fine. One pillow, walking 2 miles. Vitamin D, they're taking. Chronic kidney disease, they know to keep water handy and stay away from Motrin. They're taking their medicines for blood pressure, not having any chest pain when they walk up a hill. I've made myself a note to see that they have a nevus on the mid-back that was suspicious to me one time before. So that generally means I've taken a picture of it, and sure enough, there's a picture of a 7 millimeter, 6 or 7 millimeter tan nevus that has a little bit of irregular edges, but it's pretty much symmetrical. I'll have to watch that in the physical. Review of systems, no fever. Let me review the past history and see if there's something I need to be aware of during the visit. And then I'll go ahead and do the physical exam. So they look fine, neck, breathing. Just have a little bit of a murmur, systolic. And no edema. They did have that nevus. Unchanged from the photo. Wait, how is that so fast? Okay. On the physical examination, each time I click an item on the left, I have choices on the right to choose from, where I can always add free text. But if it's something that I already know is normal, I can push the shift button down when I click on the left, and the top item on the right is automatically chosen, which is in this case is simply pedal pulses are present. So after I do the physical, the assessment is filled up with the items that I addressed during this visit, not any other items in the problem list, and I can edit it further if I want to. Then typically I'll go ahead and write my medicines. Famotidine, 20 milligrams for a month. Go ahead and refill other medicines that might be due. Losartan's due, torvastatin's due, maybe Lasix. Then I'll go back to my note and write in the plan for myself and for the patient. So take Pepsid, avoid night snacks or fatty supper. Continue the regular medicines. Tell me reflux persists or worsens. And I'll have more tests to do. And return in 4 months with BNP before. Okay. All right, so now when I say okay, I'll see the note that I wrote, and I can go up here to chart note and counter summary for the summary that is for the patient. And the clinical assistant will read this to them, take Pepsid a month, avoid night snacks, and they have a list of their medicines to refer to when they take with them. And then my note is done, and I've got time to talk to them some more. So tell me about this reflux. Are you under any special stresses lately?